Namaskar. Myself, Dr. Shambo Samrat Samajdar. I had done my MD in pharmacology and DM in clinical pharmacology, and also done my diploma in allergy asthma immunology, along with fellowship in respiratory and critical care from West Bengal University of Health Science, with postgraduate diploma in clinical endocrinology and diabetes, certified by Royal College of Physicians, Kolkata. Myself now engaged in allergy practice at a premier institute in Kolkata, Allergy Asthma Treatment Center, situated in Moulali. Today, we will discuss about a very important topic, that is autoimmune disease. So let's start today's discussion about autoimmune disease. So what is that? So autoimmune disease happens when our body's natural defense system cannot tell the difference between my own cells and the foreign cells, and that causing the body to mistakenly attack normal cells, our own cells. So there are different diseases that can be due to this autoimmunity. Generally, the rheumatoid arthritis, psoriasis, psoriatic arthritis, lupus, systemic lupus erythematosus, which may damage different body parts, including joints, skins, organs, different other organs like kidneys. Also, a very common thyroid disorders that can be due to this autoimmune dysfunction, autoimmunity. It could be hyperthyroidism or hypothyroidism, and type 1 diabetes, where this immune system mistakenly damage the insulin producing cells in the pancreas, and we become completely insulin dependent. So we need to know about this autoimmune disease. There are multiple factors that include genetics, environmental factors, our personal health, and the female, they are more prone to develop autoimmune disease compared to the males. There could be varying types of autoimmune disease, as we had discussed, but many of them share similar type of symptoms. And what are the common types of symptoms? It could be fatigue, extremely fatigability, joint pain, swelling in the joint, different skin disorders, skin problems. It could be itching to rash to some bullous issues, abdominal pain, some long-term digestive problems, recurring fever, glands could be swollen. So it is often very difficult to diagnose this autoimmune disease. And we often say that why my immune system attacking itself? So there are risk factors, as already we had discussed, like genetics. Like in case of SLE, or that is lupus disease or multiple sclerosis, there is a they tend to run in families. So having a relative with autoimmune disease increases our chance, our risk, but that does not mean we will develop a disease for a certain. So that is important to note. Weight, again, we know this time the obesity is certain type of pandemic, and being overweight or obese, that will raise our risk of developing rheumatoid arthritis or even psoriatic arthritis. So this could be because more weight puts greater stress on the joints, because that fat tissue makes substance that encourage inflammations. So more inflammation, more autoimmunity. Smoking, the research, lots of studies had shown the smoking is linked with autoimmune disease, especially lupus, rheumatoid arthritis, hyperthyroidism, and multiple sclerosis. Also, as a clinical pharmacologist, always we try to increase the awareness on drug-induced disorder. So there are certain medicine which may cause autoimmune disease, certain blood pressure lowering medications, certain antibiotics that can trigger the drug-induced lupus, which is often more benign form of lupus. So it is not like that you should stop all those medicine, but if you have symptoms and you're feeling that this, after consuming this drug, I have this type of problem, you should contact your prescriber so that your prescriber can reconcile, can take the complete medication history and your symptoms so that they can capture these drug-induced problems. So, as we are now in an allergy center, and many of our allergy patients, they present to us with autoimmunity. We need to explain them. This is not allergy, this is autoimmunity. We need to understand the basic difference between allergies and autoimmune disease. Yes, the allergies and autoimmune disease, both of them result from an inappropriate immune response. There is no doubt in that. So in case of autoimmunity, as we had discussed, it is an inappropriate response to a self-antigen. While in case of allergy, it is an inappropriate response to harmless environmental antigen. Very common example, grass pollen. This is actually a harmless environmental antigen. This is not going to cause any symptoms to those persons who do not have allergy. But that harmless environmental antigen, like grass pollen, like cat dander, dog dander, dust mite, that can produce inappropriate response inside you, and you will become allergy. So in case of autoimmunity, this is a self antigen that will cause the inappropriate response, whereas allergy means the inappropriate response will be to a harmless environmental antigen. So this is the basic difference between autoimmune disease and allergies. So there is one similarity in the pathways of development between allergies and autoimmune disease. What is that? The involvement of immune cells. So with allergies, the immune system reacts to harmless substance, or as we had mentioned about different allergens, which lead to activation of immune cells. Similarly, in autoimmune disease, the immune cells may recognize self tissues, our own tissues, as foreign bodies and mount an immune response. That will result in tissue damage and inflammation. So, there are certain environmental factors such as allergens, medications, toxins that can trigger or even exacerbate the allergic reactions, while infection, different microbes, stress, exposure to certain environmental toxins have been implicated in triggering the exacerbation of autoimmune disease. And as already we had mentioned, gene is a very critical factor. So genetic factors also play a role in the development of both allergies and autoimmune disease. Certain genes are associated with increased risk of developing allergies or autoimmune disease, and genetic factors can also influence our immune cells, cytokines, their production, and other immune response. So, as we learn more about the immune responses in autoimmunity and allergy, we are discovering that in some cases, variants of the same gene are involved in both. These suggest there could be a connection between immune-mediated diseases. So this is something important to note. In immunology science, the more we learn about one type of immune-mediated reactions, diseases, the more we find commonalities with others. So while we are talking about allergies and autoimmune disease, they share some similarities, including the involvement of immune cells and genetic factors. They diverge at certain points. One key area of interest between this autoimmune disease and allergy is what type of immune cells involving. So we know there is some overlap between cell types that involved in autoimmune disease and allergies. Both may have some pathogenic CD4 T cells like that. We have a separate lecture on that, how a CD4 T cells that may become self-reactive and allergen reactive in the later. So additional cell types are unique to each disease, like mast cell in allergy. The most important point is to note that here the immune cells can drive inflammation and tissue damage in the target organ. So that is why we need to understand this connection, and always it is important to note sometimes some anecdotal reports that had shown response to some allergens also can cause autoimmunity. So overall, the relationship between allergies and autoimmunity is not simple. It is a complex one. Often varies depending on the individual, the specific allergen or autoimmune disease, and the different other factors as we had discussed. So not all individuals with allergies will develop autoimmune disease. Not all autoimmune disease are triggered for exacerbation of allergies by allergies. So understanding this association of allergies and autoimmune disease would have important implications for diagnosing, managing, and treating immune-mediated disorders. So we need to find out those specialists who can collaborate on care when possible in order to fine-tune a treatment plan. So many of our patients who are coming to us for allergy, they may be suffering from autoimmune disease, and that is why we need to exclude those autoimmune disease early so that the patient can be treated with proper medications and other advices. Thank you. Wish you a healthy life. Thank you.